All right, hey, sorry I've been gone for a little bit. We've had 2 crazy months going on here. We've had revival for about 2.5 weeks. It was an amazing move of God. It was so awesome to get to be in those services. And then we got a new little puppy in the house. This is Piper. So we've had to kind of change our schedule a lot here lately. So to get to be with her and teach her how to not use the restroom in the house. So that, and then my grandfather passed away. So I'm sorry I've been gone for so long, but I have been doing a whole lot of research and studying here lately on hormone replacement therapy. And so I want to share with you guys exactly what I've been learning, because there's so much that I did not even realize about hormone replacement therapy and what all goes into it, what all is part of menopause. Like, everybody just thinks that it's hot flashes and night sweats and irritable women, but there's so much more that goes into it. As a matter of fact, these are just a few of the symptoms of hormone replacement therapy: acid reflux, acne, anxiety, joint pain, asthma, new or worsening autoimmune diseases, bloating, body composition changes, which means that like you start gaining weight around your belly, brain fog, brittle nails, burning sensation in the mouth or the tongue, chronic fatigue syndrome, crawling skin sensations, decreased sexual desire, dental problems, depression, difficulty concentrating, dizziness, dry or itchy eyes. Sorry, you can hear the dogs. Dry mouth, dry skin, eczema, this electric shock type sensation, fatigue, fibromyalgia, frozen shoulder, headaches, heart palpitations, high cholesterol, hot flashes, incontinence, insulin resistance, irritable bowel syndrome, irritability, itchy ears, itchy skin, kidney stones, memory issues, menstrual cycle changes, mental health disorders, migraines, mood changes, muscle aches, night sweats, non-alcoholic fatty liver disease, osteoporosis, pain with intercourse, sarcopenia, which is muscle loss, sleep apnea, sleep disturbances, thinning hair, thinning skin, tingling in the extremities, tinnitus, which is ringing in the ears, TMJ disorder, unwanted hair growth, urinary tract infections, vaginal dryness, vertigo, weight gain, and wrinkles. That is just everything that is encompassed in menopause. What happens when we start losing our estrogen and our progesterone. And so this is stuff that I want to go over with you for the next couple of days and just kind of talk about. A study that came out in 2002, the Women's Health Initiative, and it just literally scared everybody to death. The problem with the study was this: whenever they did the study, they showed they had 4 different arms of the study, okay? So the first arm was people that had never had a hysterectomy. So these people still had their uterus. These women still had their uterus. So the first arm in the study was women that had their uterus and they were put on hormone therapy, and then the control group still had their uterus, but they were just put on placebo pills. The next arm of the study had people that had had a hysterectomy in the past, and they did not have their uterus anymore, so they were placed on hormone replacement therapy. And then the women that had had a hysterectomy in the past, they were placed on placebo. So they did them 2 different ways, because the thing is, if you still have your uterus, then you have to have progesterone in your hormone replacement therapy. But if you don't have a uterus, then you don't have to have the progesterone in it. So as the study was being done, it started to show that originally the people that did not have in the progesterone arm, the ones that had uteruses, that those people that did not get hormone replacement therapy, there was 4 out of 1,000 women that contracted breast cancer, okay? The ones that did have hormone replacement therapy, there was 5 out of 1,000 that had, and there was tens of thousands of women in that arm, but that was just the relationship to 4 out of every 1,000 or 5 out of every 1,000. So relatively, if you look at that, if you have 4 to start with and then you have 5, that's a 25% gain. So they were like 25% more risk of you having breast cancer if you are on hormone replacement therapy, but that's not exactly true, because the actual is like 0.08%, because you went from 4 out of 1,000 to 5 out of 1,000. So even though it's one more, that is 25%, but it's really not a 25% gain on that. And then once you looked at the estrogen side of it, the ones that did not get progesterone, that did not have a uterus, they actually had a 30% decrease in breast cancer. And there's tons of studies right now that are showing that the all-cause mortality of people or women that are on hormone replacement therapy is actually going down when they're on hormones, because we're only about 1 of 5 mammals that actually go through menopause. And so when we lose the estrogen, we have so many estrogen receptors throughout all of our body. They're in our joints, they're in our organs, they're in our blood vessels, they're everywhere. And so actually we're seeing an increase in cardiovascular disease, we're seeing an increase in osteoporosis, we're seeing an increase in Alzheimer's, all of those things in women, because we are going through menopause. And so we're losing that estrogen. So this can happen at a wide range of years, okay? So average age for menopause is 51 years old. You can be in perimenopause up to 10 years before that. So perimenopause is the time when your ovaries are starting to fail. You're born with all of the follicles, which are your eggs. So you're born with every one of them that you're ever going to have. Whenever you start ovulating or start menstruating, whatever age that is, and you start to go through your follicles, that can be slowed down by how many bursts that you have, because that stops you from ovulating. If you breastfed, that stops you from ovulating. All of these things are going to push your menopause number up higher. So if you were a lady that never had a baby and never breastfed, you may go through menopause quicker than someone who had 3 or 4 children. So this is the thing. On average, if average menopause is 51 years old, and you can start perimenopause at 10 years prior, whenever you start running out of eggs, and you're going to start seeing those menstrual changes. You might see a quicker menstruation or more time in between your menstrual cycles, or you may even start to see heavier flow as your progesterone levels fall off. Those things right there are going to start causing you to have menstrual symptoms. So perimenopause, that time there, you can have all of the symptoms that we just talked about a while ago: the brain fog, the muscle aches, the joint pains, the frozen shoulder, the irritability, the increase in triglycerides and cholesterol levels, the increase in autoimmune disorders, the foggy brain. All of those things can start happening up to 10 years before you go into menopause. And so we're averaging between 45 and 55 years of age. So if it starts 10 years before a 45-year-old person, that is 35. So you can start having perimenopausal symptoms in your 30s. So definitely probably having them in your 40s for sure, okay? So perimenopause is that time beforehand when your hormones are just all over the place. They're up and down, up and down, up and down, and you're having all of these symptoms just randomly. And then comes the menopause year. So this is the year you go 1 full year without having a period. So let's say you go 11 months, and then on that 12th month you have a period. You have to start all over. You have to go 1 full year without having a period to be considered menopausal. Menopause lasts for 1 day, basically, okay? So that's that 1 year mark, and you have not had a menstruation. So at that point, you are menopause. Now, the day after, you're postmenopause. So we all say menopausal or menopause, but the thing is, it only really lasts for 1 day. So we have premenopause or perimenopause. We have menopause on that day that we are free, and then postmenopause. So postmenopause is going to be all the time in your life afterwards. So if this happens at the age of 51 and we live to 80s, you're living 35 years postmenopause. And all of these symptoms can be hyped up during that time because you have that loss of those hormones. So over the next couple of days, I'm going to kind of show you some studies and things that are showing that all-cause mortality, which means all the reasons in your body that can cause you to kick the bucket, can be decreased by being on hormone therapy. But there's also a time window that you need to get that in, and that's within 10 years of menopause, okay? That's a little bit harder to understand and find if you have had a hysterectomy because we don't exactly know where that is. There are some lab tests that we can do to kind of find that, but in reality, if you are a female and you're having any of these symptoms, you definitely need to call, make an appointment with us, just kind of talk it through, and let's see if we can help some of your symptoms and maybe answer some questions for you over the next couple of days as I go through some of these statistics and things that I'm going to show you over the next couple of days. But this has been completely eye-opening for me, and as a person that is definitely probably perimenopausal, I had a hysterectomy at the age of 30, so I'm not really positive for sure where I'm at in this, but I'm going to run some tests on myself as well to see how many follicles I might have left. I'm for sure in the perimenopause stage, and I know that I'm having these symptoms. You can ask my husband because my house stays at 66 at nighttime. So you ask him if I'm in the perimenopause stage, he's going to say absolutely yes, because I freeze him to death. Over the next couple of days, we'll kind of go through some of this, and I hope I can answer some questions for you and hopefully help you, make you feel better.